in ice hockey.
Yeah.
Okay. And then, so where do you experience most of your pain?
So I have a lot of C-spine problems and my SI joint slips.
Okay.
And that's a problem that I have on like a regular basis.
Okay.
But so mainly between like my C-spine and in between my shoulders and then my SI joint slipping. I've also had left knee surgery.
Okay.
So that I feel like plays an effect.
Right. So into that left SI joint.
It's my right SI joint.
Okay.
So, and I tore the ligaments in my ankle, on my right ankle one, so I kind of like zigzag.
Right. Yep. Okay. That absolutely could be the compensatory issues up and down the spine. So we're going to just do a little bit of examination and kind of see what we find here. Right off the bat, we see that we have some anterior posture, shoulder posture. And a lot of it could be, what's your posture like when you're playing hockey?
Standing over like that.
Standing over like that, right? Like puck over, moving forward, in that attack position. So that could be one of the attributes. How long have you been playing hockey for?
21 years.
So it's a long time.
It's a muscle memory thing at this point.
Yeah, muscle memory. And then what do you do for work?
I'm a teacher.
Teacher, so.
But I try not to sit as often as possible.
Yeah.
I'm up and walking around a whole lot.
Okay, cool. So we're going to do a little bit of examination, just kind of see what we have. Right, we already know we have the anterior rolled shoulders, so working on expanding the back and opening the upper back is going to be what you probably want to focus on. Which there's some neck exercises that you can use, because if we're having the C-spine issue, cervical spine is going to have a nice curve, but as the curve starts to dissipate, it's going to lean forward. So wherever the neck goes, that's where the shoulders are going to go. So it doesn't matter what you do to the upper back, if we don't strengthen that cervical posture and correct that cervical posture, those shoulders will continue to roll forward. So we're going to do a little bit of assessment here while we check you out. So let's have a seat here, facing that way for me. Okay, and all right, so I'm just gonna feel here. Tenderness in here. Tender in here.
Not as much as the other side.
Okay. Have you been to a chiropractor before?
Yes.
Yeah. Who have you seen before? Here.
He's from up in Pittsburgh. That's where I moved from.
Cool. How long have you been here?
Since July.
All right. You saw our videos?
I did.
Right. Tenderness in here. Okay. So there's good mobility. There's just some tight muscles here, and a lot of it could be the posture. You feel like the difference in mobility here, how there's less mobility there versus right over here. See how there's better mobility on this right side?
Yeah.
Okay. So we know we're going to get some good movement in here. Bring the shoulders back for me. Good. Tender in here?
Just around my shoulder blades.
Okay.
Yeah.
So strengthening these muscles here, the rhomboids, the lats right here, the upper back muscles is what's going to bring those shoulders back. And then when we do that, we're going to be able to correct this cervical posture here, the curve here, okay? But that rolled position here, when these muscles end up being stretched, they're weaker, so they're going to have more susceptibility to be in pain. So those trigger points all the way around the scapula are going to be what we deal with. Someone your age, you played hockey for a long time, so you're probably going to have more traumatic issue like in the SI joint, the L5S1, than someone that doesn't play or not athlete like your age.
Yeah.
So we likely, I wouldn't be able to see that without a lumbar X-ray. At this point, what I do is I kind of see what's going on, see how you respond to care, and then from there decide if we need imaging or whatnot, okay? So I'm still going to do a little bit of examination on the low back as well. Up here, I think it's postural, and then we have a lot of tight trigger points related with that postural issue. So let's have you lay face up right here for me. So head right in there, lay in face up. I'm going to drop this a little bit here. Okay, now, all right, you had right knee,
left knee
surgery? Okay.
And my meniscus is partially torn a little bit right now too.
Okay. All right. Without bending your knees, lift both legs for me. Hold it right there. Go a little higher. Hold it right there and don't let me push down here. Any pain with that?
No.
Just kind of abdominal pressure of doing it?
Yeah.
Let's go a little higher. Hold them right there and don't let me push down. Any pain with that?
No.
Nope. Okay, good. I'm going to help you up here. All right. Stand up right here, facing me. And then if you can, touch both toes for me. All right, come back up. All right, turn facing the opposite way. Touch both toes. Come back up. All right, very good. Okay, lay right here face down. I'm gonna palpate the low back here, okay? Check foot leg here. All right, so we definitely are gonna have some hip instability, we have the right leg look shorter than the left. Let me just do a little bit of assessment here. Relax here. Okay, come back up. I want you to lift your head, turn to the right, and put your head back down. Okay, lift your head, turn to the left, back down. Okay, lift your head, look forward. Tuck your chin. All right, same. Good. Okay, so we know it's coming from the pelvis. You said it's the right SI joint that you have issue with? All right, relax right there for me. Tender in here.
Oh, yeah.
Tender in here. Tenderness not in here. Yep. Down into here. Over here. Yep. How's it over here?
A little tender. But
Not as bad as like this side over here. Okay. All right, very good. We'll chat a little bit here. So I was checking leg length, right? And I was checking to see if any differences in neck movement would change your leg length.
Yeah.
And they're not. So when we look at the leg length, we're seeing that the right leg is a little bit shorter than the left leg. That's where you're having the SI joint instability. You already told me that, so I knew that that would be kind of what we're gonna find with examination. But I wanted to actually physically do the exam and kind of see that, right? We know up in the upper back area, it's gonna be more trigger point related. So strengthening the upper back. So in your situation, chiropractic adjustments, deep tissue therapy, stuff like that would be ideal for you. So we use, what did your last chiropractor use? Did he use like E-stem?
I would get stem with either heat or ice, and I would go on like a roller table as
Okay,
well.
cool. So we're going to use electronic stimulation. We're going to use hot heat packs. We're going to do chiropractic adjustments, some deep tissue therapy, a little bit of focal therapy, and then vibration plate. Okay? So we'll do all that today if you're cool with that.
Yeah.
All right, very good. So we'll have you lay face down here, and we're going to set you. You're good with setting up for adjustment after this, Jason?
Oh, yeah.
You got time? All right, cool. All right, so I think we should definitely get your muscles nice and relaxed here. We're gonna go ahead and use the stimulation, mainly around this SI joint. But if you could feel, we have this gluteal involvement right here on the piriformis muscle. Are you okay if I stim up and down that muscle?
Yes.
All right, cool. All right, so I'm gonna go like 2 and then 1, 2.
Okay.
Okay. Here. You might.
Yeah,
I don't know
yeah.
if you. Okay. Sorry. Okay, very good. All right, and around the scapula, I'm gonna sit up in here. Tender in here. Tender in these guys. This as well. More on this side. All right, we're gonna set these up equally bilaterally, so you're gonna really feel a nice contraction as we set up the stimulation. When you used to get stim at your old place, did you feel it like wear off after a few minutes?
Yeah, it would like he had it timed
Yes.
so that it would like contract and then release.
Right, got you. Okay, cool. That's what we're gonna use here as well. How long were you going to him for?
I went to him for about a year, I would say, but
Cool.
not consistently, just like off and on.
Got you. Here comes the lower one, okay? We're gonna start some stimulation down low. Now we're gonna take it up to your tolerance level, so it shouldn't be painful, but you should definitely feel a deep contraction there, okay? You tell me when to stop.
That's good.
Good. Same thing on the upper. You tell me when to stop.
That's good.
Good, very good. We're gonna set up a couple of hot packs on you here. Very good. So how's your day been? What grade are you teaching?
7.
7th grade. So that explains a lot of how your day has been.
You got that right.
When I was 21 years old, I was a interim teacher for a Baptist school 7th grade class. Oh my gosh.
Yeah, they're a handful, that's for sure.
Those boys in that age are rowdy.
You better believe that. They're crazy.
All right, good. All right, we're gonna let that run for about 12 minutes, and I'll be back in here shortly, and we'll get you adjusted.
Good deal.
All right, thank you.